Welcome everyone. Today we delve into a sensitive but highly important topic, erectile dysfunction or ED, and the various treatment options available. Now before we venture into the world of treatments, it's crucial to understand just how common ED is. When we say common, we're not talking about a handful of cases here and there. We're talking about millions of men worldwide. In fact, it's estimated that about half of all men aged between 40 and 70 have experienced some form of ED. That's a staggering figure. Now these numbers are not meant to alarm you, but to highlight the reality that ED is a pervasive issue. It's not an isolated, rare condition that only a few men face. It's a widespread concern that affects men of all ages, backgrounds, and lifestyles. Knowing the prevalence of ED, it's important to understand that it's not a taboo topic, but a medical condition that can be addressed. Before we dive into the treatments, let's first understand what ED is and how it affects the body. Erectile dysfunction, or ED as it's commonly known, is a medical condition that affects a man's ability to achieve or maintain an erection suitable for sexual intercourse. This isn't just a one-time event, folks. We're talking about an ongoing issue that can cause significant stress, affect a man's self-confidence, and contribute to relationship problems. Now let's delve a little deeper and understand the physiological process of an erection. When a man is sexually stimulated, nerves in the brain send signals to the penis. These signals increase the flow of blood to the penis, causing it to expand and become firm, leading to an erection. This is a complex process involving the brain, hormones, emotions, nerves, muscles, and blood vessels. Erectile dysfunction can occur when there's a problem with any of these components. For example, if the blood vessels in the penis are too narrow to allow adequate blood flow, or if the brain doesn't send the right signals at the right time, ED can occur. Hormonal imbalances such as low testosterone levels can also contribute to ED. In essence, ED is often a symptom of an underlying health issue. Conditions like heart disease, diabetes, or neurological disorders can all disrupt the complex process of achieving an erection. Furthermore, psychological factors like stress, anxiety, or depression can also interfere with sexual arousal, leading to ED. The good news is, understanding the cause of your ED can help guide your treatment options. For instance, if a hormonal imbalance is the culprit, hormone therapy might be the best approach. If the issue is psychological, therapy or counseling could be beneficial. Now that we understand what ED is, we can discuss the treatment options with clarity. It's important to remember that while ED can be a challenging issue to face, it's also very common and nothing to be ashamed of. With the right information and support, it's entirely manageable. So let's move forward and explore those options, shall we? Interestingly, the first line of treatment often involves lifestyle modifications. It's not just about popping a pill, it's about taking a holistic approach to your health. Now you might be wondering, how can changing my lifestyle help with erectile dysfunction? Well, let's dive right in. First off, regular exercise. It's a no-brainer. Exercise improves blood flow, and good blood flow is crucial for erections. Plus, exercise helps you maintain a healthy weight, which is essential because obesity can lead to or worsen erectile dysfunction. Next up, a healthy diet. Eating a diet rich in fruits, vegetables, whole grains, and lean proteins can improve blood flow and help manage conditions that cause erectile dysfunction, like heart disease and diabetes. Now let's talk about smoking. If you're a smoker, quitting could significantly improve your erectile function. Smoking can damage your blood vessels, which is not what you want when you're dealing with ED. And lastly, limiting alcohol. While a glass of wine might help set the mood, overdoing it on the alcohol can dampen your sexual response. So, moderation is key. Incorporating these lifestyle changes won't just help improve your erectile function, they also have a positive impact on your overall health. They could help prevent heart disease, lower your risk for diabetes, and even boost your mental well-being. Remember, lifestyle modifications not only improve ED symptoms but overall health too. If lifestyle changes aren't enough, medical treatments come into play. Now let's dive into the ocean of medical treatments available for erectile dysfunction, or ED. When we talk about medical treatments, we're referring to a wide range of options, from prescription medications to hormone therapy, and even penile implants. Prescription medications are often the first line of treatment for ED. These medications work by enhancing the effects of nitric oxide, a natural chemical your body produces that relaxes muscles in the penis, increasing blood flow and enabling an erection in response to sexual stimulation. Commonly prescribed medications include sildenafil, vardenafil, and tadalafil. These medications can be highly effective, but they're not suitable for everyone. Men with heart conditions, for instance, might need to explore other options. Now let's talk about hormone therapy. Sometimes ED is caused by low levels of testosterone. In such cases, testosterone replacement therapy can be an effective treatment. This therapy can be administered through injections, patches, or gel. However, it's important to note that this treatment is only suitable for those with confirmed low testosterone levels, as excessive testosterone can have adverse effects. Finally, we have penile implants. This option is typically considered when other treatments have failed. Penile implants involve surgically placing devices into both sides of the penis. There are two types: inflatable implants, which can be pumped up when an erection is desired, and semi-rigid rods, which keep the penis firm but bendable. Penile implants offer a permanent solution to ED, but, as with any surgery, they carry risks such as infection or malfunction. Each of these treatments offers potential benefits, but they also have their own set of drawbacks and potential side effects. Prescription medications can cause headaches, facial flushing, or upset stomach. Hormone therapy can lead to acne, breast enlargement, or mood swings. And, as we mentioned, penile implants carry the risks inherent to surgery. The best treatment for ED varies from person to person. It depends on the individual's overall health, the underlying cause of ED, and personal preference. It's crucial to have an open and frank discussion with your healthcare provider about these treatments. They can help you weigh the benefits and risks, and guide you towards the treatment that's best suited to your situation. Medical treatments offer a range of options, but it's important to discuss these with a healthcare provider to determine the best course. Remember, ED is a common issue, and there's no need to feel embarrassed or isolated. With the right treatment, you can reclaim your sexual health and confidence. ED isn't just a physical problem, it can also be linked to psychological issues. As we delve into this segment, it's crucial to understand that erectile dysfunction isn't an isolated issue. It often interweaves with the complex tapestry of our mental health. Let's talk about counseling first. This approach provides a safe haven for individuals to talk openly about their concerns and fears related to ED. Trained counselors can help navigate these emotional landscapes, offering strategies to cope with stress, anxiety, and any negative feelings tied to ED. Now, on to cognitive behavioral therapy, or CBT. This is a type of talk therapy that helps people identify and change negative thought patterns that lead to harmful behaviors or emotional distress. With ED, CBT can be particularly effective. It helps individuals reframe negative thinking around their sexual performance, fostering a healthier, more positive mindset. In some cases, it may be beneficial to involve a partner in these treatment processes. This not only helps build understanding and empathy, but also promotes open communication, strengthening the relationship and reducing performance pressure. Remember, it's okay to seek help. Mental health professionals are there to support you, providing tools to manage stress and anxiety, enhancing your overall well-being, and consequently, your sexual health. Addressing the psychological aspect can often be a key component in successfully managing ED. So don't overlook it. It's not just about treating symptoms, it's about understanding the root cause and working towards holistic health. We've covered a lot today, from understanding ED to exploring various treatment options. We delved into the prevalence of ED and the importance of understanding it, not just as a physical condition but as an issue that can impact many aspects of life. We highlighted that lifestyle modifications can indeed be effective treatments, emphasizing the role of diet, exercise, and sleep in managing ED. We proceeded to discuss medical treatments, exploring the range of options available, from oral medications to surgical procedures. We underscored that these treatments have their own benefits and potential side effects, making it crucial to consult with a healthcare provider to make an informed decision. We also touched on psychological treatments, underscoring the importance of mental health when dealing with ED. We stressed that therapy, both individual and couples, can be a valuable part of a comprehensive treatment plan. The key takeaway from our discussion is, there's no one-size-fits-all solution to ED. The best treatment plan is one that is tailored to your individual needs and circumstances, and this can only be achieved through professional help. So remember, it's okay to reach out, it's okay to seek help. Thank you for joining us today. If you found this video helpful, please like it, subscribe to our channel, and share your thoughts in the comments section. Remember, there's no shame in seeking help for ED, you're not alone, and there are treatments that can help.